Et premier lauréat cette année, il nous mène aux Philippines. C'est ATIPAN+, un programme qui permet aux populations les plus éloignées de systèmes de soins de bénéficier de téléconsultations via smartphone ou tablette. Et grâce et surtout, entre autres, à l'implication de coordinateurs de soins directement issus des communautés. Et on le découvre en images.
Our project is called ATIPAN Plus. ATIPAN is a native word. It means to take care of. The project is actually a telehealth program to remote, indigenous, and rural low-income communities in the central part of the Philippines called the Western Visayas region. Their communities are very small communities that are subsistence communities, so they occur very far from the cities, and they're very poor and marginalized. So in those places where they dwell, there are no healthcare facilities, and it takes a while to get to their community sometimes. So we established this telehealth program so that they can do their healthcare within the locality. Healthcare is very easy to access now, and they don't have to travel long distances to get healthcare. I think our community healthcare coordinators were almost the heart of our telehealth program, because they were community leaders, and then they were the ones leading the facilitation of the telehealth. So I think maybe this is the reason also it became very successful, because we already had somebody who was highly trained and who was trusted by the community. By around the end of our first funding, we attained a very high number of telehealth consultations, and I think this was mainly due to the healthcare coordinators.
Voilà, ATIPAN+.
ATIPAN Plus, Pia, Regina, Fatima, Zamora.
En même temps, voilà, Pia, toute première question.
First question. What is it like to have come from the Philippines, all the way from there? Now, what is it like to... Can you hear? Can you hear? Yes? Can you hear? Can you hear the translation? Yeah? Okay. Pia, for us, the Philippines is the other end of the planet. So what is it like for you to have come to Lavore, Toulouse, Pierre Fabre to receive this prize? What is it like for you?
Most, it's validating, both for the Center for Informatics and at the same time also our partner communities. It gives us the idea that we are in the right direction in terms of digital health and who to give access to.
Une des clés du succès
One of the keys of the success of this project is based on health coordinators who come directly from the communities. Why did you make that choice, and how do you choose and train these coordinators?
So we wanted to work with the communities. So for the telehealth setup to be able to work and to be able to be implemented well, we needed health coordinators from the community. So they know the language, they know the social, cultural barriers, and they are chosen by the leaders of their community. Not only the leaders, some of these communities, they have the community resolution. At the same time, they do hold meetings, and they are the ones who chose them. We have our own criteria, but it's just a guide for the community leaders who to choose. Like, for example, those who can understand Hiligaynon, so that's our dialect, as most of our doctors actually speak Hiligaynon. They have to, at the very least, know how to speak Tagalog. And English is not a required language, so either of the two.
Le reste de la question, effectivement, c'est comment...
And the rest of the question is, how do you train these coordinators in your center?
So we actually bring them, all of them, because it's a lot easier and cheaper, to bring them all to the city where the center is located. So they are trained in health data ethics, as they will also be a part of the team who will be seeing a little bit of the health data. At the same time, also training on how to use the ONIEM Tele, so that's our database platform, and also the use of the gadgets. And other than that, they are, although we have IP, indigenous peoples communities, we also have rural low-income communities. So in those areas, we also do cultural sensitivity. And alongside the training for health coordinators, we also have the training for the doctors.
Toute dernière question, Pierre-Régina, est-ce que vous avez...
Last question. Have you been able to measure the impact of your program on the health of those communities that you serve?
So this is, like, we only touched the tip of the iceberg, honestly. It's only been 2 years. But first, we have been able to provide healthcare access together with the communities. So it didn't actually start as a co-maker setup, but it did along the way because we wanted to engage them. Because for it to, in order to be sustainable, the communities need to be, they need to be a part of it. And then at the same time, so that's one. And then, sorry, can you please repeat?
Non, la question était celle...
I was asking you, what is the impact on the health of the inhabitants?
So, one, again, the communities were able to provide healthcare access. So as shown in the video, there were, at the end of 2023, so that was the end of the 2-year project of the first funding that we got, there were about 7,000 plus beneficiaries. So those beneficiaries are from the partner communities themselves. Also, some of the communities that were not originally partnered communities, but actually heard that at the ATIPAN services are being made available in our partner communities, they actually go to the healthcare coordinator. So we actually did not, the services weren't contained in the partner communities, but all the other underserved areas in the region actually were able to benefit. So this just gives us an idea of how much more we can do in this setup. And then other than that, although we haven't really did a formal a formal study on this, but we did get testimonies. So especially for indigenous people. So the indigenous peoples community, particularly for the ATI, they are usually being discriminated. So they're quote unquote, they are dirty, we don't want to be seen by the doctor because they might say this and that. So that actually adds to them not being able to access healthcare, even though healthcare services, some healthcare services are near their community. Sometimes they do not want to go there because of such discrimination. So with telehealth, they are able to consult with a doctor and at the same time also be able to do it in a rather comfortable manner within their community. So I believe that's the three. So that's first, that's healthcare access. Lastly, the data. data. So in the last 2 years, we had the data already. We have the top 15 conditions, the medications, so we can use that for resource planning.
Et on voit, comme avec vous, les questions de data, de sociologie.
Data, sociology, evolution of society through technology, all this is linked together. Thank you for this project. Dr. Bunscheid is going to give this prize. Please come up. Dr. Buchai, you're a pillar, a long-time partner. Why is this partnership important for you?
The partnership with the foundation, right?
Yes.
Yeah, I think this project is a very good example of the mission of the foundation that would like to get people who are not have opportunity to get the healthcare, to be able to do that. And these projects, I think this project is demonstrate that we can use the digital technology to implement the way that we can equalize the opportunity to access the healthcare. This project implement in the indigenous people, citizen, which has a very less opportunity to do that. So to me, I think this project is had been demonstrated both sides. One side is the mission of the foundation and also our network that would like to use the technology, the digital health technology, to benefit the health system and healthcare. So it is like Dr. Pierre said, you can see that, like you summarize, it's not just the technology, it's sociology and the people and also the good heart of the doctor in that community that would like to reach out to the opportunity people to get more healthcare services. So, and she said, this is just the tip of the iceberg, which means that they work very well with the people, the provider, and the people working very closely. That's why the middle people, like the coordinator, is very important, and they use the strategy that to get the people in that community. I already talking with Dr. Pierre about how you choose them, but the way that they go to interview and then come up with the consensus, and this is, I think, the perfect for you to get this kind of the award.
Merci. Bon, je vais vous laisser remettre ce prix. Venez.
I'll let you give this prize. Please come to the front so that we can take photographs with the whole team. A round of applause for this prize. ATIPAN Plus, a project developed for remote communities in the Philippines. Thank you very much. Please stay with us. I propose we go to Thailand now for the second prize winner. Estrat is the name of the project. Health in 3 hospitals using blockchain technology to guarantee the confidentiality of patient data. Digitalize healthcare data via blockchain.
Technology to create a secure patient control personal health record system in Thailand. A Web3 healthcare infrastructure that integrates all stakeholders in the healthcare ecosystem, including hospital, healthcare providers, patients, and healthcare technology platforms into a single platform. This system enables seamless and secure sharing of healthcare information with high levels of privacy, trust, and transparency, putting patients at the center and ensuring interoperability across the ecosystem. And this innovation solution addresses the fragmented nature of healthcare data, not only in Thailand, but globally. HealthTAG has a significant impact on the healthcare landscape by empowering patients, streamlining workflows for providers, and fostering a data-driven ecosystem. Patients benefit from secure control over their health data, enabling informed decisions and improved care coordination. Healthcare providers gain access to comprehensive patient records, facilitating accurate diagnosis, efficient treatments, and reduce administrative burdens. Ultimately, HealthTAG contributes to a more connected and effective healthcare system, supporting the future of healthcare and improving health outcomes for all.
Voilà, le projet HealthTAG. Pour recevoir ce prix, on accueille le docteur Deshowat Promda qui est venu de Thaïlande.
Promda from Thailand, welcome. You already have a mic, so congratulations. I have a question. Now we understand how important blockchain is to guarantee the confidentiality of patients' records. But is the patient sensitive to that? Is it important for the patient?
You want me to ask you again?
Yeah.
Yes, I was just asking you, that may seem stupid for you, but does that has any effect, this blockchain, about the patient? Does he really care about that when he goes to the hospital?
Oh yeah, that's right. Actually, patient doesn't care about the technology. What we build is we try to make this kind of deep technology access to our patient, even though they are ages or they can use smartphone by creating just one tag that can connect with the blockchain network. Yes, we just use the blockchain technology to create a secure and interoperable healthcare systems. That's why we choose this technology, because it's highly secure, and also we can control the privacy inside of the smart contract. Yes, but patient doesn't have to know the technology behind. Yes.
Mais vous indiquez, ça c'est très important, que le patient peut avoir accès.
You said that the patient can have access to this data. What can the patient do with this data that he has access to? Did you hear, sir? No.
I can ask you, you said in that video that each patient can have any access to the data. What could I do concretely with those data, for instance, and do patients really use this opportunity to have this access to the data?
Yes. Actually, right now we only pilot for the medical data. So patient have they can control their access to the data from the different hospital. and also can give the white list to the healthcare provider to access their medical records with their own consent.
Okay.
Yeah.
Et toute dernière question, cette fois-ci du point de vue hôpital.
Last question, from the point of view of a hospital, what is the advantage for a hospital, as it is a competitive advantage relative to other hospitals?
As a physician, I experience firsthand the challenges caused by fragmented healthcare data, and that is why I create this kind of technology to reduce the problem, to enhance more efficiency of healthcare providers, and also reduce the problem from the fragmented data. That is the benefits from the hospital. Yes.
Ouais, d'avoir un bénéfice pour les soignants. Je peux oublier, ce sont eux qui sont aussi au cœur du...
I had forgotten that caregivers are the heart of the system. Nicolas Menetti, Regional Director for Asia and the Pacific, the university agency which is a long-standing partner of the e-health observatory. Nicolas Manetti, what is your opinion about this project? The mic. Congratulations for this project. As you recalled, I work in Asia and the Pacific for e-health, and this is a good testimony of the high innovative capacity of this region. So this is encouraging. Why did you come today here to award this prize? The University Agency of Francophonie is the first university network in the world with more than 1,000 member universities, and we are a regular collaborator of the Pierre Fabre Foundation in Southeast Asia with various networks, and we also various programs, and we also have networks of pharmacists and physicians. So we are highly directly concerned by this theme. And we are going to have our International Assembly next week. Thank you, Nicolas Magnetti. Please come to the center of the room so that you can award this prize. And we'll take a photograph.
Voilà, on va faire une belle remise de prix, une belle photo.
Right, beautiful photograph for this prize award. Thank you very much. We come into the end of the morning. I presume you have some questions to ask our prize winners. Do you have any question? Yes? Good morning. A question for HealthTAG. What are the means you have to authentify the patients? Authentication means. We are going to repeat the translation.
It identifies the patients. I don't know which technology do you use or what kind of applications.
To identification.
Yes.
For the patients. Right now, we use just the KYC technology to identify the patients in front of right they are arrived within the hospital. Yes, not. Okay.
No, just speak in your microphone.
Okay,
That's because of the translation.
Okay. Yes. just normal KYC, yes, to identify the people right in front of when they're alive in the hospital. Yes.
D'autres questions, d'autres remarques dans la salle?
More questions or more comments in the room? None? Okay. Yes, madam there. Good morning. I'd like to congratulate you and ask you a question on the teleconsultation program. I understand that there is a dialogue with health professionals. What are the clinical elements that you can take, like taking your blood pressure, listen to the heart? Do you have the necessary devices to do that? On the other hand, beyond consultation, what is the organization of the patient's management for access to medicines, for example, and for the durability of your program, the sustainability of your program?
Great, thank you. So we start off with the healthcare coordinator. So as I said earlier, we already have the gadgets, the phones, the tablets, but at the same time, they also act as the ones who take the vital signs at the very least. So you have your heart rate, blood pressure, respiratory rate, your pulse oximetry. So they do all that. They are also trained to do that. And then at the same time, during the teleconsultation, they also man the tablets and the phones. So they also know how to work on the database platform. And right after the teleconsult, we have actually medications and a little bit of funding, if we have, for direct dispensing to patients. And at the same time, we also have funding should there be like CBC, complete blood count, your general chemistry, blood chemistry. So we can do all that. Now, of course, we cannot do, we don't have the funding for that part of the teleconsult. So we also link up with some of the local government units. So there are local government units who we actually have a memorandum of understanding or agreement wherein with the teleconsult details, we provide them. The patients can actually go directly to them and get the medicine. At the same time, there's also another local government unit wherein there is funding available really for the entire jurisdiction of that unit, wherein the teleconsult patients can also avail of that one. At the same time, now for the sustainability of the project, so one really is the continuity of care. So telehealth cannot do everything. So at the very least, what we can do is have the most basic medications and then the most basic blood test available. At the same time, also maybe address conditions at the very start of the spectrum, not the ones that are on the worst part of the spectrum. So those, the acute cases that need emergency care, we immediately refer them to the nearest emergency room or the nearest hospital. So that is, I think that's the next part of our work, is to establish that continuity of care, the referral network that these patients need to be actually integrated in the first place for them to, just complete the entire thing.
Question au fond de la salle, Caroline.
A question at the back of the room. For Kia. This question is asked from Vincennes. When you developed the solution, how did you take into account the specificities of ethnic minorities? Did you take a social approach as well in order to understand them better?
On demandait lorsque...
When you developed the solution, how did you take into account ethnic specificities, the specificities of ethnic minorities? Did you adopt a social approach in order to understand better how they operate and their culture?
So, if I understand it right, so there are specificities socially within the community. So, okay, in terms of accessing healthcare for these communities, what we noted most was most women actually go to consultation together with their children or sisters, grandmothers, mothers, aunts. So they would usually, their conditions, especially if it's benign, actually get addressed when they actually bring someone along. So they don't really go directly even to a teleconsult with a benign condition. So only if it's truly painful or if it's really, they're really afraid of what the outcome might be, that's the time when they go to a consult. So that's for the women. For the men, they work during the day. And most of the time, actually, they are the ones who actually have the conditions that are in the worst spectrum already when they come to us because, like I said, they had to work. So a particular case would be an infected wound. So it went on for like 2 weeks, and that's when he started to consult. But by that time, a teleconsult is not enough. It needed to be cleaned already at the emergency room. But he still didn't want to go to an emergency care. So after a thorough advice, we gave him an antibiotic, but at the same time we said, if it does not, if things don't go well in like 3 days, you have no choice, you have to go. So that's one of, like, in terms of accessing healthcare. Another would be the ATI community. They have their own cultural setup. For example, they have their own beliefs. So they usually come to us when they have exhausted all those beliefs already. And that's okay with us, actually. So.
Toute dernière question de Madame.
One last question, Madame.
So my question is for HealthTAG, and if I understood correctly, HealthTAG using a blockchain technology and FHIR standard, you make the health data available to the patients, the health data that is from the electronic health records of these 3 hospitals, right? And what kind of health data is it? And then did you face any kind of constraints in terms of the legal regulation about what kind of data could be shared or not? Did you have to have like approval from the government? And also, did you face any kind of restraints, resistance from the physicians, for example? Sometimes they don't want to health data available to the patients, right? It's in a way, it could be like a monitoring quality evaluation. So did you face that kind of, any kind of restraints or constraints?
Yes, first of all, for the regulation part, yes, we face a lot of problems that have to be solved from the regulation part, such as the GDPR or PDPA, the privacy regulation in Thailand. Yes, we have to work with the government and let them approve our system and also our technology for using to manage the privacy of sensitivity of healthcare data of the patients. And yes, we got some resistance from the providers as well, from the different hospitals, especially in the private sector. They don't want to share the records. That's like in the public hospital. That is why we start in the university hospital and start in one of the biggest hospital network in biggest medical school and oldest medical school network in Thailand called Siriraj Hospital. They have 3 different hospitals, but in the same network. So that is why they wanted to share the record across the border. But in the private sector, we still got a lot of resistance from sharing the record, because they don't need to they don't need everyone to see the electronic records. Yes.
Merci docteur pour ces précisions. On peut applaudir une fois de plus nos deux premiers lauréats.
Thank you very much. Now we are coming to the end of the first part of this award-winning ceremony. Thank you for all those of you from all over the world who've been listening to us.